This is Dr. William Summers from Albuquerque, New Mexico, and I had a patient that ended up in the emergency room after a little bit of a fall and a sprain of his back. And first thing they did in this 78-year-old gentleman was give him some opiate pain medication. And the next thing that happened was he got goofy. Fortunately, the family called me and we did some things to reverse his goofiness. But it reminds me of a great tragedy that goes on in this country every day to hundreds and thousands, possibly even 10,000s of patients a day. Elderly people have compromised brain function. Medicines that can cloud their consciousness, such as opiates, which are pain medication, or sleeping pills, tranquilizers. These types of medications fog their memory, and then what happens is they stumble and fall again and amazingly break things like hips and collapse a vertebra and stuff like that. And you know, you can't get the docs to not prescribe this because they're in pain and people want them to do something about pain. It's hard not to do a prescription. But by golly, when my colleagues do that, I'm thinking they're acting like Napoleon, doing something kind of crazy. So if your doctor lets your elderly person who is in pain, try to relieve the pain and they get goofy, take them off the pain medicine right away. Take them off the tranquilizers right away, the muscle relaxants, those types of things. It's very important to do this because the brain in older people is a little fragile. Now, there are tricks to reverse it. There's ways to strengthen the brain. I mean, for example, memory revitalizer will strengthen brains if taken over time, and maybe they can tolerate these things better. But be cautious out there. Be cautious out there if you fall and have to go to the emergency room. Thank you.